I mean, and then, right after Kylie came out, I think Kristen Cavallari came out, upsized to 340, and then Alex Earl. They all have very different looks.
Kylie Jenner talks about her implants and why this is important to patients. Kylie Jenner spilled all the details about her beautiful natural results, and we are here to talk about it. I'm Dr. Ashley Amalfi, board certified plastic surgeon, and I'm here with my partner, Dr. Smita Ramanathan, and we are Lipstick and Lipo, your unfiltered guide to plastic surgery. And we are here to dig deep about Kylie Jenner's news, how it broke the internet, and what it means for you.
How are you?
I'm so good, hon. How are you?
Good. I mean, it is pretty crazy that she literally started this whole trend. She was very outgoing, outspoken about her implants, the details of them. And then what we saw afterwards, literally every single
Yeah,
other celebrity
I
talking
love
about
it.
surgery, which I love because I think it's so important, especially for celebrities that are looked at as role models to be open about what they've had done, right? So we don't set un- unrealistic expectations for other women.
Yes. Yeah, it's not just, olive oil and yoga. Like there's stuff happening to celebrities just like everyone else. And they're not just having babies and magically, shrinking back up. And I think it's so cool that we're just in this new era of plastic surgery where people are being honest. The story behind how Kylie Jenner shared it was kind of cool. Did you hear about it? So there was like a blogger who was like begging her to tell her results. So this blogger was like, I'm obsessed with Kylie Jenner's boobs. I need to know what they are. And then everyone was like, oh, yeah, right. She's never going to reply to you. And then she did. And she like sort of gave information on like what kind of implants she had, how many cc's they were, that they were part under the muscle, which we should talk about. But I think people were just like blown away because she was literally following this girl and then actually replied to her, which I mean, if I was that blogger, I would probably, it would blow my mind too. That girl's like newly famous.
I know, exactly. Well, I
Yeah.
didn't know the story about it, but I think it's so cool because you know what? It's like it's really cool that the most important thing about celebrities, right, is that they have a following and people look up to
Yeah.
them. And for her to respond in that way, I think be honest about it, I think
Yeah.
is cool.
Yeah.
Um, so
That's
should
the
we
thing.
break down these like implants a little bit and
Yeah.
talk about
Let's break it
size?
down.
I mean, there's so much to talk about. So when we talk about implants, we're talking about breast implants. They're silicone, saline, go under the muscle, over the muscle. There's so many nuances, but every
Yeah.
implant is different on every single person.
Right.
So while I think it's so cool that she is very open about it, I think it was 455 cc
Yeah.
implants in her are not going to look the same on somebody else. And
Yeah.
that's really why it's so important to come and talk
Yeah.
to us, right?
I think that's so important because there's some patients whose bodies and chest you could put 455 in and it would look absurdly enormous. Absurdly enormous. And there's some people who you would put that in there and you might not even know they have a breast plant because it would look so natural. And that's sort of the nuance, which is like why we don't want you guys necessarily to come in with an exact size because some of it has to do with the measurements we take as surgeons. And then we're going to help you get there. But I love when people bring in inspo pictures because if you bring me in Kylie's inspo picture, I can see what it looks like on her and then help you pick something that's going to look like that on you. And it might not be the same implant, but it helps us get a similar result, right?
Yeah, no, absolutely. And I think that, it's sort of like each implant it's like that glass slipper effect. There's like an implant that like perfectly fits your body. And of course, we have a little wiggle room when you bring in those inspo wish pictures. Because a natural result for you might not be the same for me. And so we really want to make sure that we're delivering the overall result that you have and to meet your goals. And so, someone who's a little bit smaller and more petite can have that look with like 300 cc implants, right? So really is dependent on your measurements, your anatomy, and even just the breast tissue, the skin quality. There's so many factors that come into play.
Yeah. It's
And that's
kind of like when you're explaining it, I'm like thinking of that show, Say Yes to the Dress. We need like a saying in plastic surgery because it's like It's almost one of those, like, they're speechless moments where when you, like, try that implant on and you look in the mirror, the patient's just like, "No." Like, it just looks like it's supposed to fit. The patient smiles just like when you try your wedding dress on, and it's just like that incredible moment. But we help guide you there so you don't have to try on 250 different implants. We kinda get you to this little range where we know these are all gonna look really good, and then we find the one that, like, speaks to you.
Yeah,
So,
exactly.
I feel like that's like a good kind of description of size. Don't be so like perseverating on the number. It's more of the look.
Right. I mean, and then, right after Kylie came out, I think Kristen Cavallari came out.
Yeah.
We had 300 cc implants that were then upsized to 340. And then Alex Earl was talking about her size implants, which are sort of upper 200s. They all have very different looks
It's
because
wild, right?
are all very different.
And that's a big range.
Yeah, and that's a huge range. But I think this is why it's so important to really come and talk to us, like you said,
Yeah.
right? I mean, we can really deliver a very personalized, um, individualized sort of consultation where we're looking at you to deliver those results. But do you want to talk about implants a little bit more and sort of, she said half under the muscle, half
Yeah, let's talk about that.
there's so many factors. So, I feel like a lot of people were confused by this half under.
Well, because it's not really medical terms. It's just like
Right.
Kylie Jenner, and I think how she understood what she has, which I think, in those words might be a little confusing to people, but, like, you know, what do you think she means when she says half under the muscle?
So it means it's under the muscle. So it's a submuscular implant. Typically, the two planes that we put them in is either subglandular, so it's right underneath the breast tissue. It sits over the muscle. There's subfascial as well, and then submuscular. And submuscular, in her instance, the muscle just really sits on the top of the implant. It gives it a
Yeah,
little compression, so you get that natural slope at the top. And then the bottom of that implant just sits under the breast tissue, and that's what gives you until like roundness, right? So it gives you that very natural breast shape, but it's under the
yeah.
muscle.
Yeah. And if you think about it, guys, like if you've ever seen an anatomy picture, your pec muscle in your chest kind of goes at a diagonal. And so this part of the implant is covered by muscle because that's where the muscle is. And we release it just a little bit. And then the bottom of the implant, there is no muscle there because your muscle is not that long and wide. And so that part of the implant is not under your muscle. So that's what she means by part under the muscle. The muscle only covers part of the implant, but it is an implant that is strategically placed under the muscle. And there's pros to being under the muscle. And for many, many years, that was like literally all we did because the muscle kind of helps squish the upper pole of the breast implant. And that gives you a nice natural shape. So you don't have like a big ball or a big shelf here if you don't want it. And so the muscle kind of squishes things down a little bit, which can give you a really natural looking result. The downside to being under the muscle is that when you flex your muscle, it squeezes your implant. And sometimes you can see that. We call it animation. So sometimes in patients who are super active or fit or doing jobs or physical activity that uses their muscle a lot, it might not be the best choice for you, even though it looks natural. And so then the other option would be to go on top of the muscle.
Yeah. And I think under the muscle also gives you a benefit if you really have little breast tissue, right?
Yeah.
Because it just adds another layer of, of cushion essentially between
Yeah.
and your skin. So it will minimize rippling and visibility of the implant, especially when you really don't have a lot of tissue there. So um, I think the under the muscle is a great option, but specifically subglandular is really good. I think if you do have that, good soft tissue support, but you have wide cleavage, perhaps, then you narrow that a little bit, you have a little bit more flexibility in placement of that implant because we're not limited to where that muscle is attached
Yeah.
to the bone. And I think, we have such great implants on the market these days, guys. Like these are like wonderful technology, state of the art. And so we really can deliver even natural results in the subglandular plane,
Yeah.
which past always kind of gave you that bubble
Yeah.
appearance. But I think we're with the newer implants on the market, we're able to give you really that natural result, even in that pocket.
And I think that that's the kicker, guys. Like technology has changed because, everyone's always like, well, why did we used to do it like that? And we keep changing back and forth. And honestly, technology is just better. The devices that we have and the different tools we have, like using an internal bra, if you don't have good, strong skin, and having better implants that don't have a lot of rippling, or ones that look more natural, there's just so much more technology that we didn't used to have so that all of these options are good options. There's no bad option. So whether you want to be under the muscle like Kylie Jenner or you want to be on top of the muscle and that works better with your lifestyle, you can get a very augmented look or a very natural look with either. And so that's kind of the take home is like just cuz that celebrity had this and this doesn't mean that that's the perfect plan for you because it might not work for your life.
Yeah, it might not work. And I think, it's sort of great to see all these different celebrities come out because you can see how different the look is that they've
So
achieved.
different.
And some
I saw some saline, some people had older saline implants. Cool. Yeah.
Yeah, in different sizes, like Alex Earl, I think, had a 275 and 295. So it's really great to just be open and honest about what you've had done because, you should be proud of it. It made you more confident, it made you more comfortable in your skin. And, you should it empowered you, right, to get that procedure done. And so I think that's a very good lesson to share. So we would love for you guys, if you've
Yeah.
had surgery in the past, if you've had breast implants, tag us, tell us what implants you've had done, a little selfie. I mean, I think it's just so empowering for women to know that you can achieve the body that you want. Sometimes you need a little help along the way, and that's what we're here for.
Yeah, absolutely, you guys. So let's continue the trend. Tag what you have and what you've had done and your surgeon if you've had a great experience. And then don't forget to follow along Lipstick and Lipo on YouTube, on Spotify, and now on Apple Podcast. And we will see you guys soon.
See you later.
Bye,
Bye,
guys.
guys.